What standard practices should be in place for a stem cell provider to minimize risks of stem cell therapy treatment failures? Well, their labs should be compliant with FDA current good manufacturing practices and FDA good tissue practices. Stem cells should be procured in a sterile, FDA compliant laboratory. There should be strict testing standards in place for testing and quality control. Stem cells from umbilical cord tissue should only be obtained with informed consent by donors. Stem cells should be delivered to lab production facilities directly from the hospitals where they were donated. Concentrations of stem cells should be standardized to ensure accurate treatment doses. For optimal preservation, single-dose stem cell preparations should be shipped using dry ice.